Welcome back to another episode of Debt Nation, where we are busy putting death out of business, and people are waking up to Debt Nation. They are subscribing like mad because they're realizing longevity. They love it. They love it. They love the United States Transhumanist Party. They love the conversation that we're having. And, you know, this is really good because we have some great sponsors as well that they should be looking at and they should be loving as well. Geoprotectors and nootropics, Thrivous. You got to get your hands on some. This is a great company run by Lincoln Cannon, open source nootropics. If you share this link around, you're going to get up to $160 worth of Thrivous. That's the best deal anywhere on the internet. You're not going to get a better deal than that. So make sure you spread the link around and you say thanks, Thrivous, and we all get our hands on some nootropics. Nootropics are great. You don't want to be thinking slow in these stressful times. Also, I want to say thanks to David Kelly for sponsoring the show. That's I Am Transhuman. That's I Am Transhuman campaign, doing a fantastic job out there. You know, really, really wonderful job. Lots of new posts on the website all the time. Make sure you check that. All right, so we've got a kind of an emergency broadcast here, a USTP news update with Chairman Gennady Stolyarov II. Now, this is about COVID-19 response, and if you want to follow along, pause now, go to the USTP website. That's Transhumanist-Party.org. You go to that website and you find the latest post, or we'll link the post that we're going to be looking through in the description, and you can follow along yourself and you can see the positive policies that would be implemented. I'll hand it now over to Chairman Gennady, who is going to introduce himself quickly, and then we're going to bounce into these proposals. Over to you, Chairman.
Thank you very much, Steele. I appreciate you having me over on Debt Nation during this eventful and troubling time, a time that necessitates a rapid response from all of us, and not least the United States Transhumanist Party. As the chairman of the U.S. Transhumanist Party, I have spent many hours and days recently deliberating about how is it that the world can respond to this crisis in a rational manner, an effective manner, not a fear-ridden manner, not a panic-stricken manner, which is how the world has been responding thus far. And there have been many completely ineffectual responses, like hoarding toilet paper, or in certain cities requiring people to just shelter in place, not even allowing them to go out for a run, or restricting how they may get groceries. And that's disturbing to me. While, of course, in responding to an epidemic like this, it's very prudent to practice social distancing to minimize the kinds of contact that would spread disease. One of my major concerns is that the measures that are being undertaken today risk completely obliterating the economies of Western countries and plunging people's standards of living into abysmal territory. So what do we do to respond to that, especially because we do have an active pandemic on our hands, and there do need to be some measures to control it. But we need to look beyond just being reactive, which is what Western governments are right now. We need to be proactive. We need to take the fight to the enemy, and the only way that we can do that is through the use of science and technology. So the United States Transhumanist Party has exposed a set of 11 proposals as part of its platform vote number 8. And these proposals are going to be available for public comment for the next 7 days. And then, starting on Wednesday, March 25th, 2020, there will be a 3-day voting period on these proposals, an electronic ranked preference vote, as we have done with all of our prior ballots. The only difference here is that all the timeframes are accelerated because this is an emergency situation. The world has been plunged into unprecedented circumstances. Never have we had this scale of intentional economic collapse and societal lockdown in the Western world. There have been pandemics in the past, but they have been largely in pre-scientific eras where people didn't know how to respond to them at all. So people by default allowed the pandemics to happen, and they were tragic. They wiped out millions, if not tens of millions of people. The Black Death in Europe killed tens of millions of people, killed about a third of the population. So hopefully we can do a lot better. Thus far, COVID-19 has killed about 8,000 people throughout the world, and most people who get it do recover. China has had a series of very tough but effective measures to halt the spread of the disease in China. So the vast majority of the new cases are now outside of China. And I have been thinking as well, what can we learn from the Chinese experience without becoming an authoritarian society? Because we don't want that. So the series of measures that are being proposed here can be envisioned as humankind placing itself on a war footing against this disease, but also being humane, being concerned about the fates of individuals and businesses, and not allowing anyone to fall through the cracks when fighting this disease. The goal is to save as many lives as possible, but also undo as much economic damage as possible and reorient the priorities of our economy and our society toward public health and longevity, the fight against death and disease, so that we do not experience these further pandemics. So if I may, I will go into the individual measures that are being proposed. And once again, these are tentative proposals at this time, in the sense that we encourage people to comment, go to that page that you displayed just now, make a comment on the page. You may need to pass through moderation if you're making your first comment ever on that page, but once your first comment is approved, you should be able to make subsequent comments. If you have alternative wordings, feel free to put them forward. If you have other ideas, feel free to propose them, because this is a member-driven process, even though it is an accelerated one. But the first idea that I would like to describe is one that has been implemented in China to great effect, but I would like to propose making it even more effective. In China, during the peak of the COVID-19 outbreak, several temporary hospitals were constructed very quickly. In less than 10 days, these hospitals were assembled from nothing, and they were up and running, and they were accommodating thousands of patients each. And I propose that in the United States, similar construction techniques are employed. For every 50,000 in population, one new hospital should be built. And using the lessons learned from the Chinese experience, it should be possible to construct them in 10 days or less. However, unlike those rapidly constructed Chinese hospitals, I propose that the new US hospitals become permanent. And the reason for this is we're not just seeking to solve the present pandemic. We need to be ready for the next pandemic. We need to have ample capacity to respond in the event another such virus arrives, or this virus mutates, or it becomes seasonal. So right now, the US healthcare system is woefully unprepared to deal with a situation like this. Medical clinics are already emailing their longtime customers and telling them, well, look, if you have an elective procedure, we're going to have to postpone it. If you have a non-emergency medical situation, don't come in for a while. They are literally telling patients this. So the capacity of the US healthcare system is already strained. And there are only about 4,000 cases of COVID-19 in the country and about 100 deaths. Imagine if the problem becomes worse by an order of magnitude. So a lot of people are talking about flattening the curve and trying to prolong the spread of the epidemic, having it spread for a longer period of time but less rapidly, so that the capacity of the medical system can accommodate those patients. I think that's a bit of wishful thinking, in the sense that even if you prolong the spread of the epidemic, so you flatten the curve for a while, eventually people are going to get tired of these containment measures, and they're going to try to cheat, and they're going to try to find ways around them and engage in interactions that may accelerate the spread of the epidemic later. So the key isn't to ration the existing capacity. The key is to build new capacity as rapidly as possible. So we need major new hospitals everywhere throughout the country. Everywhere where there are 50,000 people or more, a new hospital needs to be built. And any restrictions, any regulations that stand in the way of that rapid construction need to be waived, especially any zoning restrictions and building codes that in many places in the United States lead to delays of months, if not years. And it should go without saying that no special interests should be allowed to oppose the construction of these hospitals at this time, because that would be petty and it would be irresponsible. So once these new permanent hospitals have established, they need to be open in perpetuity, whether or not they're profitable. And this is a major departure from how the US economy has operated up to now. But it's very clear to me, as a result of all this, that in order to maintain normal patterns of life, in order for a functioning economy to exist at all, something has to take precedence over profitability, and that is public health. And I'm a libertarian, and I am saying this right now. Public health is more important than profits. It's more important than money. There are certain segments of life that should be insulated from the possibility of ruin just because of macroeconomic fluctuations. And I believe healthcare, especially hospital care, is one of those areas. So even if it's a new hospital built in a remote rural area, and on a normal day 5 people ever visit it, that hospital should still remain open and remain permanently staffed. So how do we do that? Well, the federal government would need to supply any shortfall in revenues for that hospital. But of course, we can't create perverse incentives with that either. So if there's a situation where a hospital has a shortfall in revenues and the federal government supplies the missing funds, the required funds for the hospital to operate, the hospital has to charge reasonable prices for its services. So there cannot be sustained the situation that exists in the United States today, where there are these charge master lists and the hospitals can charge essentially whatever they want because they expect large insurance reimbursements afterward. So what the patient pays could be a lot less, but what the hospitals charge could be many thousands of percentage points above the cost of production. So $30 for a toothpick, or several $100s for a hospital gown. There have been instances like this. So if that is to be prevented, the requirement would be that any such hospital that receives federal assistance would be restricted to charging its patients up to 110% of the cost of providing such services. And that would also have the benefit of containing healthcare costs in the United States. At the same time, the requirement to remain open and the requirement to remain fully staffed would mean that essentially by law, the supply of healthcare would not diminish. So again, this is a departure from how the American system has operated before, but we ultimately believe it necessary to have a vast and permanent expansion of the capacity of the healthcare system in the US. And essentially, this is part of shifting the priorities of society toward the pursuit of public health and longevity. And I'll be very open about what the end game with this is. The end game is radical life extension in our lifetimes. Because when those hospitals aren't responding to pandemics, when they're not at full capacity with patients, they are going to be doing research on fighting diseases, including biological aging. We've wanted for a long time for more funding, for more facilities to be put online in order to assist in this goal. We've lamented for a long time there's not enough money. There is not enough effort being devoted to the effort to reverse biological aging. Well, with this proposal, there will be ample capacity and there will be funding. And keep in mind, this effort is very much aligned with fighting any sort of infectious disease, because the elderly disproportionately fall prey to infectious disease. With COVID-19, this is starkly illustrated by the fact that for people under 60, the mortality rate is about 0.2%. For people over 80, it's about 15%. So if we want to save older individuals, reversing biological aging is the most important thing we can do in the long term. So that's the first proposal. The second proposal, I have been very pleasantly surprised at how mainstream it has become already. Mitt Romney has been advocating for this. Donald Trump has been advocating for this to happen immediately, at least with regard to the first unconditional check of $1,000 to be provided to most Americans. Now, this proposal for an emergency universal basic income is unconditional in entirety. So even millionaires and billionaires would get it. I think Trump's proposal is a little bit more limited. He would exclude the millionaires. Somehow the Internal Revenue Service would be able to tell the difference. But I don't think we need to go into that kind of means testing, because that is time consuming. It is costly. It adds additional overhead. It is much more efficient to just send everybody a check for $1,000, because everybody is feeling some sort of ill effect from this COVID-19 outbreak. Even if they're not suffering monetarily, they're suffering because their freedom is restricted. They're suffering because their movement is being limited. They're suffering because they're worried about their health. They're worried about their loved ones. So it's only fair to provide this kind of compensation for individuals. And it will go a long way to prevent massive economic disruptions. Right now, people can't engage in all of the types of economic activity that they used to engage in, but they could do something, especially with the digital economy, especially by ordering goods remotely from services like Amazon. So if they have more money to spend in those realms, then at the very least, they will be helping keep the economy going. And then the next section, of course, recognizes that some people are more adversely affected than others. So this is the section that offers full compensation to those businesses and individuals that were adversely affected. So as an example, if you are a small business owner, a restaurant owner, and your local government required all restaurants in the area to close because the government officials were worried about the transmission of COVID-19 in places where people gather. So some people might say, well, that was necessary to prevent the spread of the epidemic. Opinions may differ, but it's essential as a principle of justice that even if you have a disruption that was necessary for some reason, innocent parties should not be damaged without just compensation. So the just compensation would be indemnifying them for all loss of income and property that resulted from these government measures. So if a restaurant during a normal time in mid-March of this year could expect to get X $1,000 in revenue, but because it was required to close, it would no longer be able to get that revenue, then it should be compensated for that. And likewise, if an individual had a job and was doing the job well, and the employer wanted to keep that individual in that job, but because the business got closed, the employer didn't have an income stream, didn't have funds in reserve, so had to lay off that individual. Well, that individual also did nothing wrong. That individual did nothing to bring about this situation, and therefore should be compensated if that person got laid off, lost self-employment income because a lot of people are solo entrepreneurs, or suffered a reduction in working hours as a result of these measures that were taken to contain the COVID-19 epidemic. And I emphasize in this proposal, this compensation would be in addition to the universal basic income, not to substitute for it. So the universal basic income is necessary for everybody just to weather this storm. But this compensation is going to require going into more detail about who suffered what harms. Because again, it would be unprecedented and highly unjust for a government to just shut down vast swaths of the economy intentionally and not offer some sort of recompense for the people whom the officials frankly knew were going to suffer from this. Everyone knew that owners of restaurants, bars, airlines, hotels are going to be hurt by these restrictions. And this is what distinguishes Western societies from China and other authoritarian societies in a positive way. In Western societies, there is a culture of caring about individuals. There is a culture of really considering the impacts of each policy on an individual person or an individual business. And we have to be extremely careful to preserve that. We cannot lose that in the Western world. We cannot go the way of the authoritarian societies. Ultimately, we need to remain a small L liberal civilization in order to make it through the travails of the 21st century. So that is our proposal for the full compensation of affected businesses and workers. The next proposal is an attempt to undo a travesty of a decision made by the Trump administration. So unlike some commentators on the left, I'm not uniformly opposed to the measures that the Trump administration has taken in response to this epidemic. But some of those measures, I believe, have been foolhardy. So the Trump administration has banned essentially travelers from much of the world now from entering the US, but especially from Europe. For US citizens or people with prior authorization to enter the US, they were allowed to enter, but they had to pass through essentially checkpoints for health screenings at the airports. And the rationale was, well, they wouldn't want people infected with COVID-19 to get in through the airports. The problem is, while waiting in line for getting those screenings, these people are crowded in large rooms where there are thousands of individuals in close proximity, some of whom surely have the virus. So these are prime breeding grounds for the very pandemic. And as people pass through these screenings and get admitted because they waited in these confined spaces for such a long time, they are much more likely to become carriers of this virus. So this needs to stop immediately. And any sort of intentional creation of crowds is unacceptable at this stage. So what needs to happen is these travelers, especially if they're US citizens or permanent residents, people who were intending to come back to the US all along, they need to be unconditionally, immediately admitted through all of the checkpoints. And maybe later on, they could be required to undergo health screenings. Maybe they could be given a paper saying within the next 5 days, you need to show up to your local hospital or a local medical clinic that has been set up for the purpose of providing these tests. There are some discussions of even getting the tests done through drive-through stations. But you need to show up at one of those and get tested as a condition of your admission back into this country. That would be fine. But it needs to be done in a manner that these screenings do not involuntarily place the individuals being screened in close physical proximity to one another. And I will say again, this at this time is not an open borders proposal. It's just a common sense proposal to reduce crowding. I'm not averse to quarantining individuals known to have the COVID-19 virus in a way that could get that virus transmitted to other individuals. But it needs to be done intelligently. It can't just be done by forcing people to wait in line until they've had a screening at a highly suboptimal place like an airport. So the next proposal would be the rapid domestic deployment of military personnel from overseas. The fact is, right now the US has tens of thousands of troops in other parts of the world who are exposed to this epidemic. And the sooner they return to the United States, the more likely it is that they will be saved from contracting the virus. But moreover, the military are very good at rapid emergency response. So instead of continuing these futile foreign occupations, these same personnel could be put to much better use building hospitals, improving the infrastructure in the United States, providing rapid emergency aid, especially to people who cannot fend for themselves. I do believe we are at war right now. We are at war against this virus, and we are at war against all of the economic and societal devastation that it causes. So I believe the military needs to be deployed domestically in order to help people, in order to facilitate this massive, nearly instantaneous healthcare and other infrastructure buildup that we are going to need here. So the next proposal involves rapidly focusing on actually developing cures to these diseases. I think it's unconscionable to say that just containing the spread or prolonging the spread of this epidemic is the best that we can hope for. That is a fatalistic attitude. It is a defeatist attitude. It is not an attitude of a techno-progressive, enlightened society. So we need a cure for COVID-19. We need vaccines for COVID-19. And while we're at it, we need a cure for the common cold. We need more effective vaccines for influenza because currently even the most effective vaccines against influenza are only effective about 60% of the time in a given flu season. So we need to lift the barriers to such research. It is absolutely unacceptable that the Food and Drug Administration in the United States has degenerated to the point where it takes 10 to 15 years to approve the deployment of new treatments. We are again on a war footing, which means all of these barriers need to be lifted as soon as possible. There should be no barriers to the development of these cures and these treatments, as long as the researchers themselves believe that they have ethical intentions. So it's no longer acceptable, I think, even for bioethicists, other people sitting on the sidelines to second guess what these researchers are doing. If they believe that they are following an ethical course that is going to save lives, then nothing should stand in their way. This is the dire situation that we are facing. And so all of these artificial restrictions need to be removed immediately. So in order to accelerate research efforts in this area, I have proposed here a $100 billion funding package to be immediately made available for the rapid deployment of a COVID-19 vaccine, and for human trials to begin as soon as possible, with anyone who volunteers for them being accepted into those trials. And those volunteers, I think, would be doing a heroic service. Keep in mind, in many past instances in wars, for instance, people have volunteered to put themselves into great jeopardy for much less. But this is unambiguously a noble cause to find a cure for this disease. So if anyone wants to become part of this effort, I think they should be allowed, and the FDA should not stand in their way. So the next proposal is for another emergency funding package, this time for anti-aging research. And this is vital, literally vital, because as I have said, aging is the #1 risk factor for COVID-19 infections, as well as infections of virtually every sort. Older people die of the flu in significantly greater proportions. They're much more likely even to succumb to the common cold. So if we really want to protect the population against these pandemics, we need to make everyone biologically young again. And so $100 billion in this field can go an extremely long way. $100 billion is essentially the funding threshold that Aubrey de Grey has argued would be the full amount required to proceed at the maximum rate toward longevity escape velocity. It's not a large amount. You could take the fortunes of 3 of some of the wealthiest billionaires in the world, and you would get $100 billion. I wish they would give that kind of money voluntarily, because many of them are already pledging to give away significant portions of their fortunes. So Bill Gates, Warren Buffett, Jeff Bezos, if you're listening to this, maybe you'll want to contribute to this emergency funding package, because I really don't care how it comes about at this stage. What I know is that this needs to be the ultimate goal, the ultimate prize in this struggle. And if we can motivate people to support this kind of massive boost in funding, if we can get people to understand that this really is the only way to conclusively win this war, then it may all be worth it. But in the meantime, we need to encourage everyone to also take part in efforts for developing a cure. And citizen science is a very powerful concept. And that brings me to the next proposal. So there are already initiatives out there, distributed, decentralized, free initiatives where anyone can participate in, initiatives that try to gamify this research, like Fold It, which is a game where people explore various protein folding configurations and try to find optimal configurations for essentially getting the protein to have a specific shape or accomplish a specific task. This could be used in treating various diseases. So Fold It now has puzzles which specifically aim at developing cures or vaccines for COVID-19. I think anybody who tries those puzzles, anybody who works on them, should receive a stream of micropayments that would be proportional to the amount of time and or computing power spent on contributing to those initiatives. And if their contributions produce results with meaningful practical applications, then additional bounties should be provided. So that would be a motivator for people to spend their time here. Keep in mind, people's incomes are suffering right now. Universal basic income would help cushion the blow. Compensation for lost income would help rectify injustices. But how do we get people to behave differently? How do we get people to enlist in this war against death and disease? We need to pay them. And we need to pay them for engaging in the kinds of activities that we want to bring about. So these micropayments are a great way to do that. The next proposal is developed based on an idea that was actually implemented in Italy. Italy right now is the epicenter of the COVID-19 epidemic. This is a place where the medical system is running out of supplies to such an extent that there is triage. Essentially, doctors and hospitals are deciding not to treat certain people, people who are past a certain age or have pre-existing conditions, and that really is an unconscionable situation. It is not a situation that any civilized society should allow to occur. So how to prevent that? We need new ways of getting these components deployed as rapidly as possible. And there have been companies that have actually successfully 3D printed valves for the ventilators that are required to keep alive the patients with severe respiratory ailments. So in Italy, they've been using the 3D printed valves. I think we need to rapidly 3D print these valves, other ventilator components, other crucial medical equipment as soon as possible. And whether that's done through private initiatives or government initiatives right now is not as relevant as the fact that it be done. And every hospital, including those new hospitals that would be rapidly constructed, need to have on-site 3D printers in order to enable the future production of such components on demand. It should be unacceptable for the medical system to run out of any supplies at any time for any patient. We are living in the 21st century. It is unacceptable to ration care. It is unacceptable to triage care. But the only way we can do this right is to overcome the artificial scarcity. And then for those individuals and businesses who are capable of producing such components, especially in times of dire shortage, immediate bounties should be offered at all levels of government. Essentially, any government that can get to it and announce a prize for 3D printing certain components should do that right now. And you don't even have to wait for the Transhumanist Party to vote on these proposals. If you're a government official in any sort of decision-making capacity, start the process of instituting these bounties right now if you can, because this is truly an emergency, and having these 3D printed components available could save lives. So the next proposal deals with the impacts of this epidemic on the education system. The fact is, many schools and universities have already been shut down because of a desire to prevent the proliferation of this virus. So de facto right now, many students have shifted to remote learning. And in my view, remote learning is just as good as classroom learning. I am a strong homeschooling advocate, and I believe homeschooling and remote learning are the solutions in the early 21st century for creating a more informed, a more independently minded population. So it should be immediately permitted for remote learning to satisfy the completion or graduation requirements of all kindergarten through 12th grade schools and all publicly funded colleges and universities for an indefinite period of time going forward. If you want to prevent the proliferation of infectious diseases, allowing remote learning to satisfy these completion requirements, even when there is no epidemic, is a great idea. Because physical proximity is not necessary for effective learning, there are rapidly advancing technologies that allow for immersive interaction at a distance. And individuals benefit from it because they have more flexibility in what they choose to learn, how they choose to learn it. They can proceed at their own pace, and they can develop the skill sets that they think will benefit them the most. So the more different homeschooling approaches there are, the better, because there are so many different individual learners and learning styles. So another silver lining, let's say, that may come out of this situation is a widespread transition to homeschooling. And I believe that needs to be encouraged. And in law, it needs to be an acceptable option in all situations. And then finally, we need mandatory free housing of the homeless. And this is a serious problem. It's a growing problem in many cities of the United States because people are being artificially priced out of affordable housing, essentially because of zoning restrictions, because of building codes, but especially because of NIMBYist special interest groups. NIMBY stands for Not in My Backyard. Essentially, these are coalitions of people who own property in the area, and they want the resale values of their property to continue increasing no matter what. So they create artificial barriers to new construction and new supply. And eventually, large segments of the population stop being able to afford housing altogether, and people on the margins become homeless. When they become homeless, they live in filth. And when they live in filth, they spread infectious diseases, including being at risk of spreading COVID-19. So it's not just a matter of treating these people humanely, it's a matter of preventing them from being disease vectors. There needs to be immediate and mandatory housing of these individuals. And there have already been many admirable initiatives for the construction of tiny homes. In metropolitan areas in California, activist groups have attempted to deploy tiny homes to give the homeless decent places to live, but municipal authorities in almost every instance have required the tiny homes to be dismantled because of these protectionist NIMBYist impulses. So all of these building codes and zoning regulations need to be completely disregarded here. There needs to be a rapid construction of tiny homes, including 3D printing of homes, because there have been some innovative techniques for doing that. And then local authorities, instead of trying to stop this construction, need to go on an expedition to discover all of the currently homeless people and require them to move into these homes. Now, I'm sure most of these homeless people would go voluntarily because they would be given titles to those homes. They would become homeowners free of cost to them. Except those titles would be conditional. They would be conditional on these homeless individuals engaging in good socially beneficial behaviors, such as litter cleanup. Another source for the spread of disease is litter. And another source of litter are people who are homeless. So instead of having people be homeless and create litter, let's give them homes while requiring them to clean up litter and do other beneficial community service. There is so much work out there that can beautify the areas where we live, but there is no market incentive for that work to be done. So these homeless individuals will pay for their housing by performing this work, and they would be expected to behave responsibly because in these tiny home communities, they would be under supervision. This would also be an initiative to create some jobs for people who might have been displaced economically. And so instead, they could go to these communities, they could supervise the formerly homeless, and ensure that no alcohol or drugs get into those communities. Alcohol and drugs would be strictly prohibited because sometimes, unfortunately, people who are displaced economically, they lapse into bad habits, they ruin their own lives, and they prevent themselves from emerging out of that dire poverty. So it should be the case that these people should actually create ways out of this poverty trap for themselves. And if they stop using alcohol and drugs, if they start engaging in socially meaningful, useful work, then they're on their way up. They will become employable. They will have permanent addresses. They don't have to spend the rest of their lives in these tiny home communities. If they want to move out and not have to pick up litter all day again, they could find another job eventually. So this will eventually be a way for these individuals to help themselves. So these are the 11 proposals that we have thus far. But there may be others. I am still thinking about a 12th proposal that I may put forth in the coming days about a rapid training program for new medical practitioners. And these wouldn't be full-fledged medical doctors, but these would be emergency responders that would help process individuals who are affected by this COVID-19 epidemic. So think of a 3-month training program for people to obtain basic nursing and patient care skills, or to have them serve as processors of incoming patients so that the medical system isn't so strained for capacity with personnel as it is right now. So these are the ideas. And I would be very interested to get the public's reaction to these ideas. We encourage our members to post their comments on that page, which currently is at the top of the U.S. Transhumanist Party website. And propose alternative wordings too. If there's some aspect of a given proposal that is not completely perfect, but you think it has the germ of a good idea, make it better, because we'll have a ranked preference vote and maybe your option will prevail.
Well, Chairman Gennady, thank you so much for going through that. And I just want to remind viewers, we are talking about the Emergency 7-Day Exposure Period Platform Vote, number 8 on COVID-19 response platform proposals. That's for the United States Transhumanist Party. That's the title of the blog. Once this time period goes on, you have to go and search for that. But right now, if you are watching this live or today or within the framework of this week, it'll probably be somewhere around on the front page of transhumanist-party.org. And I encourage everybody from every aspect of life to go and check these proposals, because these are very well thought out proposals in the fact that they cover solutions to some of the emerging problems. I would just like to run through you again these problems so people can give a bit of a highlight of these. So section E88 is a rapid construction of permanent hospitals. This should be in normal policy anyway. It shouldn't be a rapid construction. Of course, the system has a misallocation of capital, and these hospitals should be already in existence. But of course, in every crisis, there is an opportunity. And public health, as you said, is non-negotiable. It's non-negotiable. People are waking up to the fact that public health, especially hospitals, access to medical care, access to all the basics, are absolutely vital and should be on equitable terms, both in opportunity and accessibility. This is really, really important, and this is a time when we could do it. $100 billion proposed there from the United States Transhumanist Party to battle not only COVID-19, but to also double up as research facilities, as ways to connect and strengthen the United States overall macro healthcare system in the wake of all of this. The emergency the emergency universal basic income. That's Section E8B. So this is essentially a form of slowing the virus down and supporting economic stimulus. This is a bailout for Main Street, not a bailout for Wall Street, in the fact that people who especially are on low incomes, especially work paycheck to paycheck, who especially have financial difficulties enough in just staying in their houses, will get some relief. So that as they do miss out on work, and this is a government-created problem in the fact that when you shut down people's ability to go to work, and those people, and there's millions of them, and they rely on actually physically relocating, whether they work in bars or restaurants or in some sort of service industry, or if you're in retail, if you shut those down, those incomes do decline, they do slide, and the bills continue to add up, and and they could end up in a state of homelessness, which again increase infectivity. That will increase the infection. So this emergency basic income coming in there at number 2, at least $1,000 per month. Very interesting. Vote on that. Full compensation of affected business workers. That's almost the same thing. That's Article 1, fully compensate all adversely affected businesses for the loss of income and property resulting from governmental measures. So this is an interesting one. This is going to be especially interesting for hospitality. Hospitality, big. If like the chairman said, if you usually make X amount, you're going to be compensated on X amount to keep the doors open so that society can refunction when everything opens back up. Fully compensate all individuals who lost their jobs or self-employment income or suffered reduction in working hours as a result of governmental measures taken to contain COVID-19. Very good policy there. Section E8, a very transitory one. Elimination of bottleneck at airports. Yes, this is a very odd policy being thrown in by the Trump administration. On one hand, saying social distancing. On the other, cramming people into short spaces, increasing the amount of infection. So you have solutions there to the bottleneck problem. Section E8E, rapid domestic deployment of military personnel from overseas. This is a fantastic option. Yes, this is what the military is built for. It's built for quick response. There's no more powerful military that can react to these sorts of things than in the United States. And when used for a benevolent purpose, such as a pandemic, to slow the pandemic, that's absolutely true. And we have to keep in mind that being out in countries with poorer healthcare responses, those service people are more exposed to risks, and therefore you're putting your military personnel in the harm's way. So you might as well use them at home domestically. Section E8F, rapid research into cures for COVID-19, the common cold and influenza, because, Chairman, it's kind of interesting because after all is said and done, the people who have other diseases, who are battling cancer, who are battling the common cold, who are battling tuberculosis and heart disease, these people are being left out of the conversation left, right, and center overwhelmed by talking of COVID-19, even though they statistically are not the largest group of people who are using hospitals right now. So, this is the cures and vaccines and other things to these pathogens that have been around for a long time. Absolutely necessary. Wouldn't have happened under USTP leadership. It says here, the United States Transhumanist Party supports the rapid research into effective cures and vaccines for COVID-19 and the harnessing of synergies from this research to develop a cure for the common cold and more effective vaccination against influenza. Absolutely fantastic there, because this is something that I think with modern medicine, with supercomputers, with access to aircraft and studying of all the plants in nature, and we knowing the periodic table and knowing a lot of the enzymes, and we should have a cure to the common cold. It's misallocation of resources is why we do not have a cure to the common cold. And we only have these minor prevention measures that you find on supermarket shelves. And they're not really prevention measures either. They're more, they help you cope with the issue. And that's not right. We should have fixed this, I think, a long time ago. Section E8G, emergency funding package for anti-aging research. If you're going to do fiscal stimulus, you might as well do it right, Chairman, and that's what you're saying here. $100 billion into emergency funding for anti-aging vaccines, because, as you rightly pointed out, sir, the aging component, a lot of the older people are getting hit by this, and I bet you now they wished they had an anti-aging program because they wouldn't be getting hit by this cold or this flu or this COVID-19 because they would be young and healthy because you get exposed to more. You can die quicker because you get exposed to more things as you get older. And so being young and healthy is literally the best defense. And we don't have enough research into aging, and we would like to hit that financial step on, for the longevity, escape velocity, like Dr. Aubrey de Grey has talked about. And, I thank Joe Rogan for his great interviews with Dr. Aubrey de Grey, exposing that to the masses that aging is and being old is literally the worst disease that you can have. It's really terrible. So good work, Joe Rogan, there for his great platform in exposing this truth. Section EHH, micropayments for citizen science initiatives. Chairman, I think this is a stroke of genius in changing the incentive structure. You mentioned Folded here, which is a game which you can manipulate the game and play with the game and actually send those to researchers, the results to researchers, which help them. Now, if you actually play this out, if this fiscal stimulus is coming, play this out across all diseases. I mean, if people are going to be locked up anyway, it'll give them something to do, and it's fun, it's intuitive. Even casinos are being shut down right now because of COVID-19. There is no, so, if this is a perfect way to stimulate a positive change while dishing out rewards for curing diseases in this time of trouble. So I think this is an absolute stroke of genius in inverting the incentive structure towards an absolutely positive outcome. But it doesn't just have to be limited to COVID-19. You can do it for any disease. You could do it for environmental problems. You could do it for space-based problems. You could do it for AI problems. You could do it for anything. It's a whole inverse flip on getting society active, engaged, and having fun, while sourcing solutions to existential risks to humanity. It's a beautiful stroke of genius, sir. Thank you so much for that time. 3D printing of ventilator components and other crucial medicines. Absolutely. Cube Spawn, James Jones, one of my favorite people in the world. This is something that you're not hearing about so much. It's bounded around, but this would be federal policy to try and encourage that. And we all know that if you could get it now, with hospitals starting to use these ventilated 3D printers, it would leak out because the people would find them useful and they would use them to prepare reserves for different health outcomes in the future. It wouldn't just enter ventilators and masks and things. This would be the start of a manufacturing revolution that would accelerate human health enterprise into the next century. It would be jumping a whole century ahead. It's not just the 21st century anymore. We'd be jumping a whole century ahead so that we can be prepared for anything that's going to happen. And this COVID-19, it's going to be gone. Life will be going back onto normal. But don't forget this. We need this, and we need this more now than ever. And we need institutions such as hospitals to be prepared in the future. Section E8J, refocusing on the education system towards remote learning. It was happening in slow motion anyway. But I think I agree with you here. I agree with you here that this is a fantastic initiative. I think it just needs to be formalized, and we have to really be careful about what information they are ingesting. And I also think that we have great solutions on here with a professor, good friend of mine from Vancouver, and we could be really embracing VR technology in this space as well, so that you wouldn't have to fully lose that communication with the other children or the learning institution. I think we could really incorporate VR into here as well. But also, with the rise of YouTube University, Khan Academy, and a whole online sources, this would be a more formal approach to outdating the existing paradigm of this old Polish school system designed for military use, and towards a much, much more 21st century option. And even if you didn't have to deploy it continuously, and you still had a mix of public schools when things are good, this would be a great option, so that you wouldn't have this confusion. Everyone would say, well, there's a pandemic now we go home to our VR suits and we just re-engage in class, and there would be no disruption. And governments are always racing for productivity, and when something like this happens, their productivity falls because of events like this. So it's their loss. They invest a lot of money in human capital, and it's their loss because they're not encouraging things like refocusing the education system on remote learning. Section E8K, mandatory free housing for the homeless, fantastic idea. Like you said, the infection, these people are stuck out there in the cold, in the weather, and they're more likely to fall to the infection. And this is a great. I don't want to mess this one up too much, because there's actually a lot in here to do with how they would get titles to these tiny houses, and how these tiny house communities would run. And actually, I think a lot of the homeless would benefit in a huge way from this particular proposal. So I want to remind everyone again, transhumanist-party.org. Please check that out and go through that. And if you're a member, of course, please vote on it. Chairman, what do you have to say?
Yes, indeed. Thank you, Steele, for that commentary. Quite astute. And these are exactly the kinds of discussions that we need to be having on these proposals. I remind everyone, membership in the U.S. Transhumanist Party is free. While this exposure period is still happening, you can go to transhumanist-party.org/membership and sign up for free and post public comments. And when it comes time to vote for 3 days starting on March 25th, you would be able to vote. So we're hoping that these ideas get as much publicity and as much traction as possible once the USTP formally adopts its package of response measures to COVID-19. We're going to reach out to the media. We're going to engage in more conversations on shows like Debt Nation, but also other shows outside of the transhumanist community, in order to spread these ideas as widely as possible. And I would also encourage our members in these very troubling times when we are constrained from interacting with people in physical space. This is the time to go into virtual space more intensely. This is the time to build ties within our movement. We are an international, decentralized, distributed movement. We have people all over the world, and the beauty of the internet, the beauty of all of these technologies of remote communication that we have now, is that we can set up fairly easy ways to maintain contact with one another. So I have challenged myself, and I'm going to challenge everyone watching this video right now to have at least one virtual interaction with somebody per day. It could be somebody within the transhumanist community. It could be someone outside the transhumanist community to whom you're reaching out. It could be some remote friend of yours. But keep up that contact, because one of the impacts of the physical isolation that is happening right now could be a kind of breakdown of society unless we actively take measures to counter that. And it's not just good for building ties within our specific community. It's good for maintaining civil society in general. It's good for maintaining human decency. It's good for maintaining the kinds of connections that we have with one another's minds, because the mind is the most important aspect of the human being, and it is the aspect that we should most cherish and seek to preserve.
People, you can participate in this party simply because it is an online party, okay? So it doesn't matter where you're from. If you're sitting in your house and you're isolated, you can participate in this party. You can write things for this party, and you can watch these shows, and you can, if you have a show, or if you know someone who has a show. I mean, we need to get Ben Zion out there onto different platforms, of course. Ben Zion doing a great job out there, of course. So, no, this is the time for us to thrive and for us to throw solutions around and strengthen the bonds of this community. This is the time, and this is what we can do, and we can continue to generate and come up with solutions to global systemic problems. And this is why this party exists, because if you live in a troubled time, or if you live in a troubled circumstance right now, just know that the United States Transhumanist Party in no way wanted you to experience that. And if you give the United States Transhumanist Party the legs, you're never going to have to experience that again. Preventative policies for you, your family, your children, for the global community, and the existential health of the whole species. Because we're off to Mars, we're off to the moon, we're going, it's gone, and we're not going to take a whole bunch of mistakes with us. We're going to learn and prevent those mistakes of going out into the universe beyond. Chairman, it's been great. Have you got anything else to say? We've run out of time on this one. Have you got anything else to say to us in your words of wisdom?
Well, since we're out of time, what I will say is, once again, please go to transhumanist-party.org. Find this post for the exposure period, make your comments there, spread the link to others, encourage others to join the Transhumanist Party. We need as many minds as possible to work on these problems. And keep in mind, what we're trying to do is be proactive, to take the fight to the enemy, to defeat this COVID-19 virus. We are not just trying to be reactive to contain the spread of the epidemic, to limit the damage. That is not ambitious enough. And we value human life. We value the life of every single individual, young, old, or in between. And ultimately, the goal is to keep everybody alive for as long as possible, healthy for as long as possible, reverse biological aging so that people aren't as vulnerable to these kinds of diseases ever again.
Absolutely. Well done, sir. And all the best with you there. Stay safe, and stay safe to the whole community out there. And I would like to thank you, obviously, sir, and David Shoemaker, a Future for Humanity project, saying the future is in your hands, and a whole ballooning bunch of people who are coming in and giving small donations on Patreon to keep. I'll have to get a list. I don't even have a list of people. There's so many people who are now jumping on board with small contributions, and we need more. But if you do a small contribution each month, you're going to keep this show on the road. You're going to keep generating solutions like this, and like you've seen for over the last few months. And we can do much better. I can do much better. I can do better. We can always do better. And this channel is now exploding. It's now blowing up. People are now realizing what is happening here, what the United States Transhumanist Party is, what Campaign to Stop Killer Robots is, what transhumanism is, how 3D printing would have averted such shocks, why public health policies are so important, the fragilities in the supply chain like we've been talking about, why TAFS is such a beautiful organization, why Mr. Holsopple's 222 is so important. People are starting to realize, wake up. and it's taken the removal of a lot of the global system to do it, to a terrible virus. But, I'm thinking that this could be the moment that the United States Transhumanist Party really, really shines in this chaos, because the bread and circuses are gone, and now people are faced with what is right in front of them. And what is right in front of them is a bunch of solutions delivered to you from Debt Nation and the United States Transhumanist Party, which says we would have averted this, not only averted this, you would be on an exponential curve to peace and prosperity, no scarcity, no disease, reversing aging, for example, no cancer. We would be on that curve right now, but instead, we're on the other curve, and I don't think people are having much fun. So, we're going to try, and we're going to continue to try, and I love how people are starting to wake up. It's terrible circumstances, but the illusion is gone. The veil is falling away, and people are realizing the mortality. They're realizing the fragility of the systems, and they're now searching for solutions. I am sorry that this is happening, but this is recoverable. We will recover as a global community, and the United States Transhumanist Party will come out better than ever, and I can't wait to see people with USTP signs all across America as America wakes up, and it's going to be great. I'm very, very excited for that future. Mr. Chairman Gennady Stolyarov II, thank you so much for coming on the show. Is there anything you had to say?
Well, one last comment. Thank you very much, Steele, for these remarks, for having me here today. To all of our viewers, remember, we are in this together, and the only way out is through. There really is no going back to the complacency of prior eras. We need to be completely invested in this fight against death and disease. This is the only way we will overcome. This is a war. This is the greatest war that humanity has ever waged. Not just COVID-19. COVID-19 is like one of the lieutenants of the enemy, but the greatest enemy is the Grim Reaper himself. And death, thou shalt die. That
fantastic. That's
what we need to believe in.
Yep, and we're gonna putting death out of business. We've been saying it for a while. I think we invested in the right saying there, so I'm very happy with that. All right, thank you, Chairman. We'll get back to you, and we'll probably be seeing you a lot in these times as you've got more to update us about the community and about the party. So I'll be seeing you a lot, as I will be seeing probably Ben Zion and a bunch of other people too. It's a very busy time. All right, thank you so much, Chairman. I'll talk to you soon, and thanks to the audience as well. Debt Nation, we're busy putting death out of business.